Well, hello. Thank you, Dr. Leota. Hi, everyone. Great to see you. I'm going to do my best to distract you from the incredibly cute whales that are over there. I love this venue. I want to thank Russ and the Health South team for having me here today. It's wonderful to see so many of you. I'm excited to be here as part of the conversation to think about advancing health and well-being of this whole region and beyond. And as I look out here, I love seeing so many students in the audience. I remember when I was in your seat and training, as you heard, I'm a physician by training, and I've spent most of my career either working for the federal government or leading state government in North Carolina before joining the team here at CDC. Through that time, my North Star has always been about how do we get better health for folks. And you'll note I didn't say better health care. I said better health. But as a physician, health care is certainly a huge component of the equation for me, but it's not the only part. Truly improving and protecting health requires connection, collaboration, and we have to do it way beyond just health care. We have to go to health care and public health and social services and education and business and many others. This really hit home for me actually when I was training as a physician. So I was hoping I can share a story from when I was a young doctor. I was training up in Boston. I was in my third year of residency, which is nearing the end. So I'm feeling pretty good about myself. And I saw a patient in my primary care clinic. I'm a primary care doc by training. She was 24. She was a full-time student, like some of you. And so she had insurance from her parents' insurance plan. And she came in with weight loss and hair loss. Okay, and she was feeling tired. All right. So she was like, my hair's falling out. That was actually her first complaint, and we kind of got to others. My hair's falling out. So I did what, doctors do. They ask you a lot of invasive questions that you don't ask at parties, like, how's your menstrual cycle doing? But then I did an exam, and then I did what most doctors do. I ordered lab tests, right? I took her blood, and we checked for things like anemia, Lyme's disease, thyroid disorder. All the tests came back normal. So I call her on the phone. I say, hey, all your blood tests are normal. How are you doing? She's like, actually, I'm really not feeling well. I'm feeling even more tired. And as a young woman, when someone says weight loss to you, and she doesn't want to be losing weight, you really take note as a doc. And so I said, what, let's get a CAT scan of your belly. Like, I didn't know what was happening, so I ordered a CAT scan. And I had her come back 2 weeks, 3 weeks later. Turns out the CAT scan was normal. And as I'm waiting to see her this second time now, I'm talking now to my preceptor, right? I said I was just training, so I was talking to the person who teaches me, and I was going through, hey, it's not this, it's not that. What do you think we should do next? And we were talking about what specialist should I send her to. When the nurse tech who checked in the patients, who does the blood pressure and your vitals, she comes over with the sheet and she sort of hears us talking and talking about what specialist, and she interrupts us and says, I really think you need to ask your patient if she has enough to eat. Yeah. Ugh, I feel it. Like, it brings me back to that moment. Right, actually, first, as a human, I got really defensive. I was like, no, that's not the right answer. That's not a thing. I know my patient. No, well, I didn't ask all the questions I needed to for my patient. And clearly, my patient had just opened up to my nurse tech and said something. So I pulled myself together, and I went into the room, and I asked the question I probably should have started with, which is, what's going on at home? And it turned out that her home was her car. Full-time student, but had just left an abusive relationship, someone her parents actually really liked and was thinking she was going to marry. And she didn't want to call home and tell them what was happening in the relationship. And so instead of telling her parents, she was sort of just making it work, living out of her car, a couple couches, eating at school, but she was struggling. And I didn't see that. When I first met her, she was perfectly put together. She had an insurance card. And so we forget that when someone walks in our door, maybe it's a healthcare door, but their health is bigger than maybe what I was thinking from my narrow, let me order a blood test, let me order a CAT scan. I certainly spent plenty of money, plenty of healthcare dollars, but I didn't actually make her well in that moment. And it's not because I didn't care. I wanted her to be well. I walked into that room with great intentions, and I'd like to think it's not because I'm not smart. You heard I have a lot of Ivy League degrees. Right, what happened there? The system, or wait, the lack of system wasn't there, right? And so it was from that story, but really before, I always was thinking about the system that we work within, or the lack of that system. And I knew I wanted to be in a position to influence that system, to influence what drives health. In addition to just healthcare, I wanted to drive health and try to think about what were all the policies that made up that system so that we can think about improving and protecting health, not just for the patient who might be sitting in front of me in that moment, but for my family, my community. So, unfortunately, her experience isn't unique. I bet most of us could think of a time where the healthcare system either failed us personally, failed our family, failed someone we know. And we know what happens for folks' health has a lot to do with what happens outside the walls of a clinic or the hospital, right? And what matters most is sometimes things like food, or where someone's sleeping, or transportation. And in North Carolina, as I was Secretary of Health and Human Services, we were able to take that idea of how do we use all the levers at our disposal for health and start a pilot using Medicaid dollars to pay for things like healthy food for people who had diabetes, or to replace moldy carpets for families with kids with asthma. Right? So instead of just paying when they go to the emergency room for their asthma exacerbation, we actually fix the underlying issue in their home and use Medicaid dollars to do it. We had to knit together partnerships to make that possible. It couldn't be Medicaid alone. It certainly couldn't have been healthcare alone, right? It was Medicaid and public health and social services and community organizations and others that allowed us to focus on the whole person and what did they need to be healthy. These kind of cross-sector partnerships must be the norm and are certainly a priority for me. We at the CDC cannot fulfill our mission, which is to protect the nation's health. We cannot do that alone in isolation. Everyone needs to be part of team health. And if that wasn't clear to all of us before the pandemic, I think certainly during the pandemic it became even more clear. And in today's highly polarized world that can feel harder than ever, but it's not impossible. We did it in North Carolina. From the outset of the pandemic, our goal as we were leading through that crisis was to build and maintain trust. Trust in the information, trust in the services, trust in institutions. And we made that happen as we led with transparency, clear communication, and operational excellence. And I know it worked because we measured it. Trust in North Carolina's information and services actually went up during the pandemic and actually increased 35% over the course of the pandemic, where we have seen many news articles that have talked about erosion of trust. In North Carolina, we were able to build that up, and in fact, trust increased the most in our Black communities, our Hispanic and Latinx communities. And that was particularly important to us in North Carolina because we really focused on equity in our response to the COVID pandemic. And we built trust with many communities that had a lot of reasons not to trust. And doing that hard work saved lives. And those are the kinds of lessons that I'm bringing to the CDC. I'm about 2 months in right now, and I will tell you, we are laser focused on trust. And we're doing that because I think it is critical to the foundation for a healthy society. We know we can better protect health when people trust institutions. Institutions like the CDC, or their hospital, their pharmacist, their healthcare provider, public health agencies, faith-based communities, or their schools. And trust isn't a feeling. It is a feeling, but it's also a tactical plan. And here's how we're thinking about the tactics of rebuilding trust. First and foremost, for me, is about being transparent. You're hopefully starting to see us step up the pace of communications, not just the technical and science information, which is absolutely fundamental and important, but we also want to make sure we're putting out information out there that people understand, common sense solutions and how things apply to you. You'll see us sharing what we know, what we don't know, and if you want to, you can follow me on Insta. So second, we're focusing on operational excellence, just as I said that. We're focusing on operational excellence after transparency. And we know that we need to make protecting your health simple and easy. We need to take down barriers. We need to go to where folks are, not the other way around. And third, we're thinking about building relationships and partnerships, and that's why I'm so excited to be here today at Health South, where that is the fundamental underlying principle of why we're here. Protecting health of this region and the country is a team sport. So I'm thrilled you decided to use your time today to be here to think about being part of team health for this region. So at the CDC, we're applying these approaches to increase transparency, make sure we're operating with excellence, and building strong relationships. And we're doing it across 3 areas of focus. So if that's the trust-building tactics, we're using them across 3 different ways. And the first area of focus is not going to be a surprise to you. It happens every year. It's called winter virus season, right? And we knew it was coming. It happens, and flu is here with us, and RSV, and now we have COVID as well. And as much as we all wish we could leave COVID in the rearview mirror, please trust me, I wish it was so. Unfortunately, COVID is here, and it's here likely with us to stay. But the good news is we have more tools than we've ever had to protect ourselves. We just need to use them. We need to make sure folks are protecting their health, particularly those who are at highest risk. So when I think about what's coming up for this winter, I am most worried about our adults who are over 65. I'm also worried about our historically marginalized communities. I'm worried about our kids, particularly for RSV and for flu. And I'm worried about our disability community. But we have the tools like vaccines, and for the first time ever, we actually have a vaccine against RSV. We have the tools to prevent serious illness, but again, we have to use them. And this is where trust is so, so important. So that's the first area of focus for us, and you're going to hear a lot about it. I want you to know, I got to say, please, please, get your flu shot. Get your updated COVID vaccine. And if you're over 65 or you're a young parent and have an infant, think about the RSV vaccine as well. I want you to know that we're also thinking about that operational excellence, as I said, as we get into the season, and we thought it was really important to continue to make vaccines free for folks. So even though we're outside the emergency, updated COVID vaccines are free for folks. They're either covered by your insurance, or CDC is running a program where you can get free vaccines at places like Walgreens or CVS or a local health department. And just yesterday, we announced that you can also order some free COVID tests again in the mail. So think about having them by your side. These are the tools we can use. So if vaccine is your choice, that is wonderful. It will protect you from the harms of this virus. If you choose not to get vaccinated, please think about all the other tools. The important part is layering these pieces of protection together: vaccine, testing, treatment, and the common sense solutions like washing your hands or wearing a mask, staying home when you're sick. If we use these tools, we'll protect not only ourselves, but everyone around us. All right, so that's the first area of focus, and you'll hear a lot from us on it, but we have to go further. Second, we need to continue to address and get upstream of mental health and the opioid crisis. We know it's a top public health concern for the country. A number of polls have just been done asking Americans, what is your top health concern? And their top one is fentanyl, right? So we need to, as a team, think about together how we're getting ahead of the overdose crisis. It's going to require teammates in public health, healthcare, social supports, and communities to come together. And we've been working hard at it for a while, but we have to put our shoulder against it in order to put it in the rearview mirror. At CDC, we recently announced another $250 million in grants to our state and local health departments to help with data capacity, because we can't solve problems we don't see. And we need to map the best solutions to these hard problems. In another collaborative initiative, again, the CDC is bringing data and best practices on overdose prevention and harm reduction alongside treatment services that are funded by SAMHSA. So even partnership across the federal government so that we can make sure that communities have what they need. All right, so second bucket is mental health. So fall and winter, virus season, mental health, and the opioid crisis. And then the third area of focus for me is about breaking down silos within public health to support young families. We need to make sure that our kids get off to the best start in life, no matter what zip code they're born in. And sometimes folks forget that CDC is actually the Centers for Disease Control and Prevention, right? And the best place to start that prevention is, frankly, before mom is even deciding to get pregnant. We want to make sure we're supporting maternal health, preventing adverse childhood experiences, and that we're working across teams to support young families. For example, we are starting a collaborative initiative to tackle maternal mortality, linking public health data to the perinatal quality collaboratives that are run by a different part of the government and in our health systems, so that we can get an even bigger impact of each and every one of those efforts. We also know that children have been disproportionately impacted by the COVID-19 pandemic, and we need to bring data and best practices to bear to support young families to navigate these challenging times. But we also know children and families are resilient and that they can thrive to their full potential with the right preventive efforts and early support. So these are our areas of focus. Fall and winter respiratory season, so go out and get your vaccines, use all the tools to protect yourself. The mental health opioid overdose crisis, so much work to do here together as a team, and supporting young families, right? Because health is a team sport. It's why we are working on shared priorities and shared accountability. It's how we will accelerate our impact on America's health. The team is big. It's inclusive, but we need all of us. State and local government, the healthcare industry, academia, pharmacies, doctors, nurses, community organizations, faith-based organizations, and the private sector. We all need to be one team, and if the pandemic taught us anything, is what an incredible achievement we can do when we come together. When we have a shared purpose, let's make that shared purpose health for this region. One aspect of operating as one team does include integrating data across the board. We can't have different data systems for every disease and every organization. We have to integrate across diseases, across populations. and across health delivery and public health. This has to be the norm of how we do our job. If oxygen for this work is data, if data is our oxygen that drives this work, we need to integrate our data into one team in order to make sure that we are all doing our best work. And then we need to prioritize. We can't do it all. We need to see where we can make progress in the next year while laying the groundwork and infrastructure for longer-term collaborative approaches. And then lastly, I think we also need to tell the story of successes and impacts on health that we're actually doing and building together right here in Georgia and in the Southeast. We need to tell these very tangible and compelling stories. That's the only way that we can help folks understand why investment in this work and in health in this collaborative way is so important. We can do it together. We can support healthy people and healthy families, and we can build a healthy nation if we do it as one team. So that's the blueprint. So if you have questions or feedback or want to build partnership with us, I welcome it. Please email me at cdcinaction@cdc.gov. That's cdcinaction@cdc.gov. Like I said, you can follow me on Insta. But by being here, you're raising your hand to say you're part of Team Health, and I look forward to that partnership together as we build healthier communities. So I thank you for the time, I thank you for the hard work, and now I turn the podium back to Russ and the team.